And our final speaker, last but not least, is Dr. Karin Walsh. She's a pediatric neuropsychologist and associate investigator or professor at George Washington University in Children's National Medical Center. Karin is also she was the initial chair of the RAINS International Collaboration Neurocognitive Group. She is also now the chair of the NF Consortium Clinical Trials Neurocognitive Committee, and she is working on trials in neurocognition. Thanks, Karin.
Thanks. Hi, everybody. I'm always glad to be here. Every time I get to come to the forum, I go home feeling very good, and there's so many people that are very kind to me and say very nice things. I go home with a lot of ego, which lasts for a little bit. Thank you for inviting me to talk about the neurocognitive clinical trials. I think one of the things that surprised me putting this together, even though I've been in cognition for a while now, is how few clinical trials actually have been done in cognition. We do a lot of research in cognition, but they're not all clinical trials. So I'm going to tell you about the 3 that have been completed and 1 that's ongoing. Just as some basis, because I think it's helpful, some of you may already know all of this, and if I'm telling you something you know, forgive me, but just what a clinical trial is. So when we're doing a clinical trial, it's different than sometimes studies that you may have been involved with, like Dr. Wiederman was saying, where we're looking more at natural history or what things, what the phenotype or the presentation of difficulties are in NF1. A clinical trial is really going to have an intervention involved where we are evaluating certain cognitive functions or aspects of cognition before an intervention is implemented, then doing an intervention for an amount of time, and that can be a medication, it can be a reading intervention, it could be an executive function intervention, something behavioral, and then we're evaluating that same skill after, and what we're looking for is change, of course, and hopefully improvement. That would be usually the goal of an intervention trial. We do that a lot of different ways in cognition. We're using computers to test different aspects of cognition. We're using paper and pencil tests. So we have a lot of different ways. And we also usually ask parents to fill out questionnaires about what are you seeing at home with regard to the skill or in the social setting or the academic setting. So just as some context of what a clinical trial is versus another kind of cognitive research study. So 3 clinical trials have been completed in NF. The first I'm going to talk about is the Lovastatin clinical trial, which is the most recently finished, completed study and has now been published in terms of the main outcomes. So like many clinical trials for cognition, we look to these preclinical or mouse model trials to kind of give us some information about, specifically when there's a drug that we're thinking about testing, have we seen something that's been effective in the mouse model? Whether that totally translates or not, there's a lot for us still to learn, and that is a challenge for us at times. But the Lovastatin trial stemmed from the mouse model trials where it showed that Lovastatin improved visual spatial skills and attention in the mouse model. So then, of course, we wanted to translate that. Would Lovastatin, which is a fairly benign drug, would it help for children that had attention problems and visual spatial problems if we treated them with Lovastatin? So participants were randomized either to Lovastatin or a placebo. They were treated for 16 weeks. I think this is on my next slide. So we evaluated their attention, executive function, behavior, and quality of life before treatment. Everyone was treated for 16 weeks, either again on Lovastatin or the placebo, and then we did testing after that trial, after that 16 weeks, to evaluate for change. And there were no significant changes on any of the primary outcomes, and the primary outcomes were visual spatial learning and attention. Now we looked at a lot of other things as well, and there was only one significant change after that 16 weeks on a secondary measure of sort of visual working memory, but it was really not seen as something that would suggest to us that there was a real impact of this medication on cognition. So the findings of this study were in fact considered negative. We're not recommending Lovastatin for the treatment specifically of cognitive deficits in children with NF1. And it's disappointing. I mean, obviously there's probably people in the room that participated. There's a lot of effort that goes into this, and this was many years in coming. So I think we're sad. I mean, this is again a drug that didn't have a lot of side effects or negative effects otherwise, but in fact we don't see that it works in our kiddos with NF1. The other 2 studies I'm going to tell you about that have been done are in reading intervention. So one that was done with the Australian group, Dr. North and Dr. Payne, was on the efficacy of phonics training to improve reading in NF1. So in general, phonics training works for children with reading difficulties with or without NF1 in the general population. It's a strategy that does work well. There's a number of evidence-based interventions that focus on phonics, and so the idea was, does this also work in children with NF1 that have dyslexia or a reading disorder? So they evaluated children at baseline for their word reading accuracy, their fluency of reading, how they could decode and comprehend written text, did a 25 or 24-week computerized reading program, and then tested the kids again at the end. So children improved on all measures of reading in that study, which I think is great. And there was in particular, if children were older in the study and had good working memory, which we know can be a difficult area for kids with NF1, but those that had better working memory had the best results of this intervention. But I think it's a good point that everybody improved. So this is important, and I think I'm going to talk about a survey we're doing in terms of the interest of the NF community in cognitive research. And in fact, I don't have a lot of results, but what I can tell you is it seems that these type of learning difficulties are high on the list for people in terms of their interest or what they think is important for us as clinicians and scientists to be focusing on. So the second study is from 2015, and this is again on a reading intervention for children with NF1. So again, the phonics-based programs, that's pretty well known that that's an effective strategy for reading intervention in general. But there are different approaches in terms of using phonics-based interventions. You can use things that are more visual spatial, which sort of just means using your eyes. And then there's more kinesthetic, they call it. So these are sort of hands-on ways of teaching phonics. So this research group wanted to determine if there was, because kids with NF1 can have visual spatial weaknesses, was it going to be important to think about these kinesthetic or hands-on approaches to reading intervention? Would that be even better? So again, pre and post testing of reading. This intervention was 15 hours over 5 days, so pretty tight timeline. And this was how it kind of all was kind of randomized out. So you had kids with NF1 and reading disabilities, and then kids with reading disabilities that did not have NF1 for a comparison group. They were then randomized to either a visual spatial program or this more hands-on kinesthetic phonics-based program. And then the kids without NF1, there was a waitlist group too, which is sort of like your placebo control group in a more behavioral intervention type of thing. So they eventually get their reading intervention, but they sort of are just on hold for a little bit so we can see that they're a group sort of without treatment. Kids without NF1 did fine no matter how you did the intervention, whether it was phonics-based, whether it was visually based or kinesthetically based or hands-on. But the kids with NF1 did much better if it was hands-on, which makes sense to me in terms of working with kids with NF1, but this is nice to have data that actually supports that. So I think this is great because it guides us. We know that phonics-based programs are going to work, but then how can we enhance that even more in our NF1 population is doing hands-on activities. And these are things like using actual letters and moving them around on the table and blocks and colors. I mean, there's a million ideas actually out there for attaching sort of more hands-on activities to these types of interventions. So that sort of gave us a highlight of, where do we go, what kinds of programs do we look for, and how do we want to implement those specifically in NF1. And then just my last slide is on something current that's going on that hopefully we'll be able to talk some more about as the years go on. We are involved with the selumetinib studies right now where we've attached a cognitive aim to those trials. So we have what we call an ancillary study. It's like we're kind of glommed onto the back of a trial. But we've been doing this for a couple years with Dr. Wiederman and the group at CHOP and at Boston and at Children's National in DC is the lead site for this. And what we're doing is using in-clinic-based computerized testing that we do prior to the MEK inhibitor. And this is really, we've been doing this in kids from ages 3 up through adults for this initial trial. This is sort of, you can consider this our first run at this to see the potential impact of MEK inhibitors. The idea based on an initial mouse model was that there may be some benefit to MEK inhibitors to cognition. There's also other studies that have another study that's come out since we started this that might suggest, at least maybe in the youngest children, there could be a disruption of development from MEK inhibitors. So I think this is a completely unanswered question, and we're hopeful that the data we're collecting from this will help guide us on whether there is some potential for benefit, or if, in fact, it's at least safe but has no consequences on cognition. So we are following children and adults through that first year of treatment on the MEK inhibitors with multiple assessments. That also includes parent ratings of executive function in everyday life. So hopefully in the fall or next time we meet here, we might have some more to say about this. And I think that's my last slide. So I'm pretty sure I stayed within 10 minutes. Any questions? Is there a mic? They're all in the back.
Well, I'm a parent. I have NF, but I'm also a parent with NF, so I'm on the NF page, and moms with NF, and I see IEP stuff come up often. Is there a way that your research can be taken to an IEP meeting so we can say, hey, research shows that this kind of reading intervention is better for my child that has NF,
yes,
so that we can bring that and make sure that they're not just giving our kids 5 minutes of phonics and actually doing some kinesthetic reading.
No, that's an excellent question. Yes, I very much support. I think the best case scenario is when I have families, I like to try to help them and work with them. I think, yes, you print out these articles, and hopefully you have a psychologist or a medical team member that can also support you in that endeavor to help you understand the article if it's not clear. I think that's important. But I would say, absolutely print these out. And again, if we can help in summarizing the findings of that and then how that specifically applies to your child, right? Because, as a neuropsychologist, there's a lot of things we can say that are summary statements about NF1. They don't apply to every single person with NF1. And when we're evaluating children, they're an individual. So there's things I understand in the context of NF1, but you may have a child that's an excellent reader, and somebody else may have a child that is not a good reader at all. And even though on the whole, kinesthetic works, you may also have a child that's more like a kid without NF1 that could benefit from either. So that testing of you or your child first can be helpful also to then pair with the literature that is out there that hopefully we'll have much more of, because we haven't even come close to discussing math disabilities and other types of disabilities. And I absolutely encourage you to print these out and say, we know this works, specifically in my children, and let's talk about how we can make this happen and really kind of collaborate with the school. Because yes, you're right, kids get into categories and then there's sort of this just, everybody gets the same thing regardless. So yes, I think you can absolutely apply what we know in your specific classroom setting and on your specific IEP. Thank you for that question, that's great.
Question over here.
Hey, good morning.
Good morning.
Foremost, thank you, doctors. I'm the father of a son with NF, a pretty aggressive plexiform. So foremost, to all the doctors who have spent your careers researching this very under-researched, I thank you, and my family thanks you. It's tough for me to talk about it, tough to be here. With that said, we got some business to take care of. My son also suffers from dyslexia, learning disabilities, etc. School systems are less than stellar, of course, in treating that. So we've been very fortunate and have my son in a private school. My question is, the Orton-Gillingham training and the things you discussed, do they work together? And this private school for dyslexia children ends at 5th grade, which my son's at 5th grade, so we have pretty large challenges coming up to try to get this kid through school. So any literature or thoughts on how it integrates with some of the more current dyslexia training?
Things like Orton-Gillingham and other types of
yes, ma'am. Just how we can intermix or look at what we're going to do next year when he's thrown into the public school system.
Yeah. There are many reading interventions out there, and what I will say is you want to look at, and there's a lot of resources to help you find these things. Actually, the Reading Rockets webpage is really a cool webpage. It's very friendly and has a lot of resources in terms of thinking about not just in NF1, but reading disabilities or dyslexia in particular. When we are helping families, we talk about starting with looking for evidence-based reading intervention, because there's a lot of reading intervention, but there's been a lot of research in general in reading disabilities and strategies for treating reading disabilities and helping. So evidence-based intervention is sort of where you want to start. But within that, there are different types. Again, phonics-based. Whole word reading interventions have been less supported over time, but it does work better for some children still. So they work together, and they actually have a lot of similarities. So don't think if you do a couple different things, you're really clashing or kind of working against each other. But I think it takes a lot of effort for families and parents in that public school setting and setting up these IEPs, and you do end up having to be loud and involved and always asking questions, and I encourage people to do that. You might be annoying to the school, but that's okay. That's the point, is that our kids are getting what they need. And again, I think that if you can get people from your medical team involved with you to support you is really key, because kids are also going to change. What your son needs now from that reading perspective may be a little different a year or two from now, and we may need to adjust with him because he's probably gaining skills and he may need the target to be a little bit different. So there's not an easy answer to your question. I apologize. But I think if you work at an individual level and we figure out what are his needs, and then how do we translate that into an IEP, and if there's not enough there, what other options do we have? Where else can we get what we need for him to keep, reading is such an important function. And you're right, I think unfortunately a lot of these programs cut off when kids start going to high school. And it's a real challenge on a number of different fronts. So I'm not sure if I really answered your question. I'm sorry. Okay, fair enough. I'm actually going to sit up here. No, I'm just kidding.
And then you can also sit next to her at the lunch and talk to her some more.
Yes.
Hi, I actually had something I wanted to share, and I think it may actually help him. And thank you so much for sharing this topic. It's so important. My son is 13 and has NF1, and this learning disability has been one of the greatest challenges we've had. He's 13 and he still has struggled so much to read, and it came to the point where the school they wanted to give up on him reading, and I had to be loud and involved, and I just would not let that happen. A program that we're just starting to have some real progress with to work is failure-free reading. He's starting to read and he's doing a really good job. So that's one to write down. It's a really good one. And then Learning Alley is a really good one as well. It's actually reading to him on an app, and it highlights the words as he goes, and he's reading books for the first time at age 13, and he feels a great sense of success. So I wanted to share those programs.
Thank you.
Hi, as a mom with a daughter with NF, I'm also a special education teacher. My brain is just swimming right now. Is there, in your study or in your goal, would there be some sort of a development of some teacher training programs involved, or even special training days for teachers at Forum in order to address some of these situations, producing it to Council for Exceptional Children, some of those reading groups, colleges? I'm just wondering what your plan is after you've collected all this great data.
Yeah, well, I will say I don't get credit for any of these reading studies because it's not actually my group, but my colleagues are doing it. And I'd be interested to know, I think the group in Australia is really carrying that work forward. They were the first reading intervention study that I talked about today. I think they continue to work on that. I think it's a great idea to think about teacher training sessions in a format like this. And somebody asked me yesterday about physician training sessions, not necessarily those of us that are always here, but more broadly in the community, because we hear that, physicians don't necessarily know what NF is. They don't know, especially in the adult world, I think. So I think there's opportunities for that. I love that idea. I will tell you that just on a personal note, a family that I work with, we had a lot of success, and again, this is on an individual basis, and I think you're thinking bigger, which is great, but on an individual basis, the parent handbook that CTF put together with some folks, has been actually a really nice tool. I had a family that took that to the school, and I worked with them, and we educated the staff at that school that working with, there's one kiddo with NF at that school, and it was an amazing interaction with them, because they were like, oh yeah, because they saw him as a kid with just ADHD, like nothing else, right? That it sort of just put him in the group of all the ADHD kids. But he had some really unique things that he needed around anxiety, around other things that they didn't quite understand. So we sent a bunch of these handbooks to the school, actually, for the teachers, and they called me and they wanted more handbooks and they wanted to talk more about it. So it really opened this dialogue. And I mean, I don't think it's perfect yet, but I think the interactions of the staff and those teachers with this particular student have changed dramatically, because they understand where some of his behavior is coming from that they were attributing to kind of the wrong things. And understanding really kind of his needs and his uniqueness, that then it sort of changed the dynamic of how they were interacting with him, and it was much more positive, which then just, impacted him to be more positive or handle things in a different way, and learn to do that. So I think there's, that's the small, that's the what we can do now kinds of things, and then taking that beyond is an amazing idea. I love it.
Okay, thank you.
Karen, can I just add to that? So the handbook that Dr. Walsh is referring to is available at ctf.org/education. It's free for download. All our other materials are there as well, other newly diagnosed. ctf.org/education. Thank you for bringing it up.
Thanks.
And
I'm
we can-
not allowed to talk anymore.
We can also
Cancel.
send some copies of people. Like, I'm an old-fashioned person. I like to touch a book. So if you want, we can also ship some books. But one thing that I just wanted to say is that this could become a topic for a next year forum. If we want to start talking about expanding our community, maybe you want to start airing this idea with the teachers of your children, and maybe next year we can do a teacher training with Dr. Walsh.
That'd be amazing. That'd be amazing.
Bring your teachers.
Okay, thank you.